Diffuse intrinsic pontine glioma, DIPG. This is a rare and aggressive brain tumor that occurs in the pons, a part of the brainstem that controls breathing, heart rate, swallowing, and other essential functions. Fewer than 400 children are diagnosed with DIPG each year in the United States, and nearly all will die within 2 years of diagnosis. Its location deep in the brain makes surgery impossible, and it does not respond well to chemotherapy. DIPG begins in glial cells, which normally support and protect nerve cells. In this disease, mutations, often in a gene called H3K27M, cause these glial cells to grow uncontrollably, spreading throughout the brainstem. Because the tumor grows within the pons, even a small increase in size can interfere with the nerves that control eye movement, facial muscles, balance, and speech. Early symptoms include clumsiness, difficulty walking, slurred speech, and changes in facial expression. As the tumor advances, children may lose the ability to move, speak, or breathe on their own. Radiation can temporarily reduce symptoms, but the tumor always grows back. There is currently no cure. Anaplastic thyroid carcinoma, ATC. This is a rare thyroid cancer that makes up fewer than 2% of all thyroid cancers, yet it causes up to half of thyroid cancer-related deaths. Only about 500 to 800 people in the United States are diagnosed each year, most over the age of 65. ATC is so deadly because it grows extremely fast, often doubling in size within weeks, and by the time it is found, it is usually spread beyond the thyroid to the neck, lungs, or other organs. Unlike most thyroid cancers, it does not respond to standard thyroid cancer treatments like radioactive iodine. ATC begins in the thyroid gland, a small organ in the front of the neck that makes hormones controlling body metabolism. It starts in cells that normally make thyroid hormones, but these cells change so much that they no longer act or look like normal thyroid cells. The cancer spreads quickly into nearby areas like the windpipe, esophagus, and nerves of the voice box, causing trouble breathing, trouble swallowing, hoarseness, and pain in the neck. Even with the most aggressive treatment, most people live only a few months after diagnosis, and fewer than 5% survive 5 years. Malignant mesothelioma. This is a rare cancer that starts in the mesothelium, a thin layer of tissue that lines certain organs. The most common type grows in the lining around the lungs, called the pleura. About 3,000 people in the United States are diagnosed each year. In roughly 80% of cases, the cause is asbestos exposure. When inhaled, asbestos fibers can lodge in the lung lining and stay there for decades. Over time, they cause scarring, ongoing irritation, and damage to the DNA inside cells, which can eventually lead to cancer. Mesothelioma often grows as a thick layer of tumor that wraps around the lungs, making it hard to breathe. Early symptoms can include chest pain, shortness of breath, persistent cough, and unexplained weight loss. Because these symptoms are similar to less serious illnesses, diagnosis is often delayed until the disease is advanced. Even with surgery, chemotherapy, or radiation, the 5-year survival rate for pleural mesothelioma is about 12%, and many patients live only 1 to 2 years after diagnosis. Long-term survival is rare. Stomach cancer. This cancer begins in the inner lining of the stomach, usually in cells that make mucus to protect the stomach wall. It can grow slowly at first, but over months or years, the tumor can spread deeper into the stomach wall, then to nearby lymph nodes and organs such as the liver or pancreas. In most cases worldwide, the main trigger is long-term infection with a bacterium called Helicobacter pylori, which causes ongoing inflammation and gradual changes to the stomach lining that can turn into cancer. Diets high in salted, smoked, or pickled foods also raise risk, while fresh fruits and vegetables lower it. Early symptoms can be subtle: persistent stomach discomfort, feeling full quickly, loss of appetite, weight loss, nausea, or bloating after meals. Some people may vomit blood or have hidden bleeding that causes fatigue. Because these signs mimic common digestive problems, many cases are diagnosed late. In the United States, the 5-year survival rate is about 36% overall, but can be over 90% if caught very early. Survival rates are much higher in countries like Japan, where routine screening finds cancers sooner. Cholangiocarcinoma. This is a rare and deadly cancer of the bile ducts, which carry bile from the liver to the small intestine. Fewer than 10,000 cases are diagnosed each year in the United States, and by the time it's found, most patients cannot be cured. The overall 5-year survival rate is about 9%, making it one of the most lethal cancers. Cholangiocarcinoma begins in the thin bile duct linings and comes in two main types: intrahepatic, which starts inside the liver, and extrahepatic, which starts outside the liver near the small intestines. Long-term inflammation in the bile ducts, whether from liver fluke infections, bile duct stones, or chronic diseases like primary sclerosing cholangitis, can lead to cancer. In Southeast Asia, parasites from raw fish cause many cases. Symptoms often begin when the tumor blocks bile flow. People may notice yellow skin or eyes, dark urine, pale stools, or itching. Others may feel tired, lose weight, or have right-side belly pain. Sadly, many tumors are too advanced for surgery when discovered. Uveal melanoma. This is a rare cancer of the eye that affects about 5 to 6 people per million each year. While it's the most common eye cancer in adults, it's still much less common than skin melanoma. It becomes deadly when it spreads beyond the eye, especially to the liver, where it's almost always fatal. Once metastasized, the 5-year survival rate drops to around 2%. Uveal melanoma starts in the uveal tract of the eye, which includes 3 parts: the iris, the ciliary body, and the choroid. It most often begins in the choroid, the layer filled with blood vessels at the back of the eye. It grows from melanocytes, the cells that make pigment. These tumors usually appear as dome-shaped, dark masses inside the eye, and are sometimes found by chance during routine eye exams. Treatment of the eye tumor is often effective when doctors use radiation or remove the eye altogether. But about half of patients later develop cancer in their liver, where it becomes untreatable and rapidly spreads. Pulmonary sarcomatoid carcinoma. This is a very rare and aggressive type of lung cancer, making up less than 1% of all lung tumors. Because it grows and spreads quickly and often resists standard treatments, it is considered one of the deadliest lung cancers. Many patients are diagnosed at a late stage, and survival beyond 3 years is uncommon. Pulmonary sarcomatoid carcinoma begins in the lungs and has a mixed structure. Part of the tumor is made of carcinoma cells and part is made of sarcoma-like cells. This makes it harder to detect and treat because it behaves more aggressively than typical lung cancers. It often starts after long-term exposure to harmful substances like asbestos or tobacco smoke. Patients often experience constant chest pain, a worsening cough, shortness of breath, and major weight loss. Standard chemotherapy helps only a few. Immunotherapy and surgery offer hope, but only for certain patients. Primary cardiac sarcoma. This is an extremely rare and aggressive cancer that begins in the heart. Fewer than 100 cases are diagnosed in the United States each year. It is deadly because it grows quickly, is often missed until it causes serious symptoms, and is very difficult to treat. Most people survive only a few months to a few years after diagnosis. Primary cardiac sarcoma starts from connective tissue in the heart, not from muscle or blood cells. The most common type is called angiosarcoma, which grows from the cells that line blood vessels. These tumors often form in the right atrium, the upper right chamber of the heart, where they can block blood flow or invade nearby tissues. Because the heart is always moving and surrounded by fluid, these tumors can spread quickly and silently. Symptoms can include shortness of breath, chest pain, or fainting. Fluid can build up around the heart, making it harder to beat. By the time it's found, surgery is often not possible. Treatments like chemotherapy or radiation may slow the cancer but rarely cure it. Chronic myelomonocytic leukemia, CMML. This is a rare and deadly blood cancer that starts in the bone marrow, where blood cells are made. It affects about 4 out of every 100,000 people each year, mostly older adults. In CMML, the body makes too many monocytes, a type of white blood cell. These abnormal cells crowd the bone marrow and bloodstream, leaving little room for healthy cells. Over time, the number of these cells can rise slowly or suddenly, leading to more severe symptoms and complications. The cause is usually random mutations in bone marrow stem cells, including genes like TET2, SRSF2, and ASXL1, that make the cells multiply in an uncontrolled way. People often feel tired, lose weight, bruise easily, or have an enlarged spleen causing belly discomfort. There is no cure unless the patient can get a bone marrow transplant. Most are treated with medicines to slow the disease, but even with treatment, many live only 1 to 2 years. Adrenocortical carcinoma. This is a rare and aggressive cancer that forms in the adrenal cortex, the outer layer of the adrenal gland that makes hormones. Fewer than 2 people per million are diagnosed with it each year. Because it often spreads before it's found and may resist treatment, survival is poor. Only about 15 to 44% of patients live 5 years, with much worse outcomes if the cancer has already spread. Adrenocortical carcinoma produces too much hormone, which causes clear symptoms. If the tumor makes too much cortisol, it causes Cushing's syndrome. Symptoms include weight gain in the face and belly, thinning skin, and high blood pressure. If the tumor makes too much androgen, it can cause virilization, or male features in women, like deepening voice and facial hair. Large tumors may also cause pain or a visible mass in the belly. Surgery is the main treatment. Chemotherapy and clinical trials of newer treatments are used when surgery isn't enough.